Hi, it's Erik Paulsen, and welcome to the Correspondence Corner. I'm taking the questions this week from the Capitol Rotunda. But before we get started, I just want to mention I really enjoyed my time at Washburn Elementary School in Bloomington. I not only had a chance to visit and read with second graders, I also had a chance to meet with fourth grade classes to talk a little bit about how a bill becomes law and take their questions. Now we're going to get into your questions. The first comes from actually Dan in Bloomington. And Dan writes in about the health care law. It says, Dear Congressman Paulsen, I received a letter from my insurance company informing me that my health insurance policy has been canceled in response to the requirements of the Affordable Care Act. The canceled policy had monthly premiums of $354.09 and limits my maximum annual out-of-pocket expense to $3,150. This policy met my needs well, providing exactly the coverage that I need. It's being replaced by a policy that costs $536.71 per month with a maximum out-of-pocket expense of $6,250. The new policy contains many features which I do not need, but now I'm forced to accept and pay for anyway because of the Affordable Care Act. As a retiree on a limited budget, these increased expenses will introduce a financial hardship that provides no improvement in my health care. Well, first of all, Dan, you're not alone. We've heard from many folks, and the press has reported in many instances of up to 2 million people having their health insurance policy canceled. I've heard from many of my constituents that have not only had their insurance policies canceled, but they've also been worried about premiums going up in excess and not being able to go to the same physician or the same doctor that they had before. Clearly, there are issues that need to be fixed with the President's new health care law. I will continue to work and sit down with anyone on a bipartisan basis that's willing to sit down at the table to make sure we find solutions to fix our healthcare system, to make sure that it is consumer-oriented, that there's a doctor-patient relationship, and that people can keep their doctor and their physician. Next question we come along that we'll take came from Alex in Mount. He sent an email in, actually, and he wrote in with this following note. It says, Representative Paulsen, I'm concerned about my ability to save for retirement. It's my understanding that the government is looking to change the regulations for financial advisors. It's my concern that it could have a negative effect on my ability to save for retirement. What can Congress do to rectify this and ensure that my retirement is not affected? Thank you, Alex. Well, what Alex is talking about are new regulations that have been proposed by the SEC and the Department of Labor. These are regulations that would make it more expensive for just regular folks or individuals to consult with a financial advisor to help save for retirement. The good news is Congress passed legislation on a bipartisan basis at a time when we need to come together, when we need to work together. We did that this week, and we passed a bill that actually slows down the rollout of these regulations. This will make sure that whether you're saving for retirement, whether you're saving to purchase that first home, or whether you're saving for your children's college education, we're not going to be increasing the expenses for the financial advisors that give you this advice on a one-on-one basis. I want to encourage all of you to send in your thoughts and your questions and your ideas to me anytime. You can reach me on the website at Paulsen.house.gov, and of course you can get me on Facebook or Twitter. Have a good weekend and a great week.